𝗪anda-𝗪𝗏r, a health policy professor at the University of Pittsburgh, lays it out. A new Medicare pilot isn't about help. It's a setup for heartbreak. She opens with Daniel. He lived in unrelenting, unexplained agony. When his doctor ordered an MRI, the insurer demanded prior authorization and denied it. What followed was a year of misery: weight loss, opioid dependency, suicidal depression. Only later did they discover a cyst in his spinal column. The process crushed him. 𝗂𝗧 calls it all too common. Her numbers hit harder. In her survey of 1,340 people, 36% said they'd been denied needed care through prior authorization. And while most denials eventually get overturned, the appeals process is so burdensome that most give up before they win. In Medicare Advantage alone, insurers denied about 3.2 million requests in 2023, but only 11.7% were appealed, and the majority of those appeals succeeded. Here's the policy wrinkle. Starting January 1st, 2026, CMS will pilot the WISeR model in 6 states: Arizona, New Jersey, Ohio, Oklahoma, Texas, and Washington. It applies to a narrow list of about 17 services, things like knee arthroscopy, certain spinal injections, skin and tissue substitutes, no emergency visits, no inpatient care, and oversight remains with clinicians, not machines. But here's where the alarm bells ride in. CMS will pay the companies running these reviews a percentage of the savings that come from denied or avoided services. In other words, deny more, earn more. That's a classic perverse incentive, one that critics compare to bounty hunters, being paid to deny access, not protect health. 𝗂𝗧 isn't just worried about policy. She warns this will hit older adults hardest. Traditional Medicare beneficiaries may face cognitive decline, multiple health conditions, and less bandwidth to fight. And now red tape plus automated denials could put their care in limbo. Doctors feel it too. More paperwork, more peer-to-peer calls, more appeals. Some even underprescribed to avoid the hassle. She ends with a simple, stark human truth. In the richest country on earth, our seniors' epitaphs should not read, "died of red tape." This pilot's limited scope matters, but not expanding it should be non-negotiable, because once denial becomes profitable, care becomes optional. If all this leaves you feeling uncertain about where to turn, you're not alone. The Senior Savings Network can walk you through every coverage path, help you find the plan that fits your health needs, and keep red tape from standing in your way. Call 1-800-729-9590 for help. Clear, experienced, and free.